Have you noticed that feeling at the back of your throat? That heavy, sticky sensation that just does not seem to go away? I want you to do something with me right now. Swallow once, just once, then pay attention to what you feel. Is there something sitting there? A thickness? A coating? A need to clear your throat again, even though you just did it 30 seconds ago? If that sounds familiar, stay with me, because what I am about to explain could completely change the way you understand what your body has been trying to tell you. For many people, this problem does not arrive all at once. It sneaks in. At first, it is just in the morning. You wake up and clear your throat a few times before breakfast. Then you start carrying water with you more often. Then certain foods seem to make it worse. Then it is no longer just mornings. It follows you through the day. And before long, it becomes such a normal part of life that you stop asking why it is happening at all. You just manage it. You sip warm drinks. You try lozenges. You avoid cold foods. You search for home remedies. You clear your throat over and over again. And because the symptom feels small compared to the bigger problems people talk about, you may have been told to ignore it. You may have even been told, that is just part of getting older. But here is what I need you to hear today. Persistent throat mucus is not random. It is not simply your body being annoying, and it is not something you should always dismiss as harmless aging. In many cases, it is a signal, a real one. A signal that something in the way your throat, nose, stomach, hydration, medications, or even digestion is functioning has changed. And once you understand the pattern, the symptom starts making sense. That is what today is about. In this video, I am going to walk you through 5 specific causes of persistent throat mucus that are especially common in adults over 55. I am going to explain them in plain language, not medical jargon. And I am also going to tell you about the 2 causes that often work together, making everything dramatically worse without people ever realizing they are connected. Because when one cause increases mucus production and the other makes that mucus thicker and harder to clear, you get stuck in a loop. More irritation, more clearing, more inflammation, more mucus. And unless you break that cycle, it just keeps going. My name is Dr. Franklin, and my work is centered on preventive health and senior wellness. My goal here is always simple: real information, clear explanations, and practical steps you can actually use tonight. Before we go any further, I want you to notice something about your own pattern. Is your mucus worse first thing in the morning, or does it stay with you all day long? That one detail gives an important clue about what may be driving the problem. Now let us start with the part of the story that most people are never told, and once you understand this, everything else makes more sense. Your body is supposed to make mucus. That surprises some people, because the word mucus has such a negative feeling attached to it, but mucus itself is not the enemy. In fact, healthy mucus is one of your body's most important protective tools. It traps dust, germs, pollen, and small particles before they can travel deeper into your lungs. It keeps your throat and airways moist. It protects delicate tissue from drying, cracking, and becoming inflamed. In other words, mucus is not a mistake. It is part of your body's defense system. The real issue is not whether your body makes mucus. The issue is how much is being made, how irritated the tissue is, and how well that mucus is being cleared. And this is where age matters. Inside your airways are millions of microscopic hair-like structures called cilia. You never see them, you never feel them, and you do not have to think about them. But all day long, they are quietly moving mucus upward and outward so it does not sit there and accumulate. When you are younger, this system tends to work efficiently. Mucus gets produced, moved, and cleared without you ever noticing. As you get older, that clearance system can become less efficient. The cilia may not move quite as effectively, the tissues may be drier, the mucus may become thicker, and small amounts of irritation that once would have passed unnoticed may begin to linger. That is the key. The same trigger that a 35-year-old barely notices can create a much more persistent symptom in someone who is 60, 70, or older. Not because your body is failing, but because the balance between production and clearance has changed. So now let us talk about the 5 hidden drivers. Cause number 1, silent reflux that does not feel like reflux. This is one of the most missed causes of persistent throat mucus in older adults. Most people think reflux always means heartburn, a burning chest, a sour taste, discomfort after a heavy meal, and yes, that absolutely happens. But there is another form of reflux that can be much quieter and much more deceptive. It is called laryngopharyngeal reflux, often called silent reflux. And the reason it is missed so often is simple. Many people with it do not feel classic heartburn. Instead, what they feel is this: a need to clear the throat, a sticky sensation at the back of the throat, morning hoarseness, a feeling of something sitting there, or a voice that sounds rough when they first wake up. Here is what is happening. At the top of your stomach is a muscular valve. Its job is to keep stomach contents down where they belong. Over time, especially with age, weight changes, large evening meals, lying down soon after eating, or certain medications, that barrier may not stay closed as effectively. When that happens, stomach acid and digestive contents can move upward. Sometimes they only reach the esophagus, but sometimes they travel higher, into the throat and voice box. And the throat is not built for that kind of exposure. Even small amounts of reflux can irritate the tissue there. And when that irritation happens, your body tries to protect itself, the way it often does, by producing more mucus. That mucus is not pointless. It is your body's attempt to coat and defend irritated tissue. This is why someone can wake up every morning with a thick, coated throat and still insist they do not have reflux. They may be right in the sense that they do not have typical heartburn, but they may still have throat-level reflux. Think about your own pattern for a moment. Is the mucus worse in the morning than at night? Do you wake up needing to clear your throat before you even speak? Does your voice sound raspy or weak early in the day? Do you notice the symptom getting worse after a late dinner, spicy foods, alcohol, coffee, chocolate, or when you bend forward? If so, silent reflux moves much higher on the list. And here is something important that many people miss. Some pain relievers and anti-inflammatory medications can make reflux worse in certain individuals. So can large meals late at night. So can lying flat too soon after eating. So can being overweight around the abdomen, because that increases pressure upward. This is why treating silent reflux is not just about taking something for acid. It is often about changing the mechanical pattern that allows the reflux to happen in the first place. And later in this video, I will give you the exact evening routine changes that can start helping as soon as tonight. But first, let us move to the second cause, because in many people, this one does not replace silent reflux, it stacks right on top of it. Cause number 2, post-nasal drip from chronic sinus or nasal inflammation. When people hear the words sinus problem, they usually imagine something dramatic: a pounding headache, pressure behind the eyes, a blocked nose, a full-blown sinus infection. But chronic nasal or sinus inflammation often looks nothing like that. In many adults over 55, it is quieter. You can breathe reasonably well. You may not have much facial pressure. You may not feel obviously sick. And yet, the tissues in the nose and sinuses remain mildly inflamed and continue producing mucus that slowly drains down the back of the throat. That is what people mean when they say post-nasal drip. And one reason it is so frustrating is that you may not feel much happening in your nose at all. The symptom shows up mostly in your throat, so you naturally assume the throat is the problem. But in many cases, the throat is just where the drainage ends up. Now, what causes that inflammation? Sometimes it is allergies, sometimes it is chronic non-allergic rhinitis. Sometimes it is irritation from dry air, dust, fragrances, smoke, or temperature changes. Sometimes it is lingering inflammation after repeated infections. And sometimes reflux can irritate the upper airway in a way that makes nasal and throat symptoms worse together. This is where people often get stuck using the wrong strategy. They reach for over-the-counter antihistamines hoping to dry it up. And yes, sometimes and yes, sometimes that gives temporary relief. But in many people, especially older adults, drying the mucus too aggressively can actually make it thicker, stickier, and harder to clear. So instead of solving the problem, it changes the texture of the problem. You feel less dripping but more coating, less running but more stuck. That is why one of the simplest and most effective tools for many people is not something that numbs the throat or dries the body out. It is saline nasal irrigation done correctly and consistently. Why does that help? Because it physically washes away irritants, loosens thick mucus, reduces crusting, and supports the natural clearance system inside the nose. It also helps the tissue recover from low-grade inflammation. But consistency matters. A single rinse may feel mildly helpful. Daily use over time is what often creates a noticeable difference. If your symptom feels like it sits high behind the nose and drains downward, especially if you are clearing your throat through the day, not just the morning, this cause becomes very important to consider. And here is where I want you to pay close attention, because we are now approaching the combination that makes so many cases worse. If silent reflux is irritating the throat from below and post-nasal drainage is coating it from above, your throat is being hit from two directions. Now add one more factor, the third or fourth cause, and the mucus becomes even harder to ignore. Cause number 3, a medication side effect you may never have connected. This one surprises people all the time, not because it is rare, but because it hides in plain sight. When most people think about medication side effects, they imagine something dramatic happening right after they start a new pill. A rash, dizziness, stomach upset, something obvious. But some medication side effects arrive slowly, quietly, weeks later, even months later. And because of that delay, people never connect the symptom to the medication. One of the most important examples is a class of blood pressure medications called ACE inhibitors. These medications are widely prescribed, and for many people they work very well. But one recognized side effect is a persistent cough or throat irritation. In some people, it does not feel like a classic cough at all. It feels more like a tickle, a need to clear the throat, or a sensation that something is constantly irritating the airway. Why does this happen? Because these medications can increase certain substances in the body that make the throat and airway more sensitive. So the person keeps clearing their throat, not because they are imagining it, but because the tissue truly feels irritated. Now here is why this matters so much. The timing can fool you. You might start the medication in January and not notice throat symptoms until March or April. At that point, your mind does not connect the two. You assume it must be allergies, weather, aging, or something you ate. Meanwhile, the medication keeps doing the same thing every day. Not every throat symptom in a person with high blood pressure is caused by medication, of course. But if your throat clearing began after starting a blood pressure pill, especially if you were started on an ACE inhibitor, that is absolutely worth reviewing with your doctor or pharmacist. And let me be clear, do not stop a prescribed blood pressure medication on your own. But do ask a direct question. Could this medication be contributing to my throat irritation or throat clearing? That one question can save people months of unnecessary guessing. There are alternative medication classes that may be appropriate for some people, but that decision needs to be made with the prescribing clinician who knows your full history. The larger lesson here is this: if you are over 55 and dealing with persistent throat symptoms, your medication list is not a side note. It is part of the investigation. Now let us move to the fourth cause, and this is where the hidden pairing becomes even more important. Cause number 4, chronic mild dehydration and thickened mucus. This cause sounds almost too simple, which is exactly why people underestimate it. Hydration. Not because drink more water is magical advice, it is not. But because mucus is largely made of water, and the difference between mucus that moves and mucus that sits there often comes down to how hydrated the tissues are. Let me give you a simple picture. Think about soup on the stove. When there is enough liquid, it stays loose and easy to stir. Leave it uncovered too long and it reduces. Same ingredients, different texture, harder to move. Mucus behaves the same way. When the body is even mildly underhydrated, mucus can become thicker, stickier, and more difficult to clear. That means something that might have drained quietly now lingers. Something that would have been swallowed naturally now sits at the back of the throat. Something that would have moved with a few swallows now requires constant clearing. And here is why this is especially important in older adults. The thirst signal often becomes less reliable with age. In younger adults, thirst tends to show up earlier and more clearly. In older adults, you can be underhydrated without feeling dramatically thirsty. You may not notice the problem until you feel dry, tired, lightheaded, constipated, or, yes, bothered by thick mucus that just will not move. Add to that common everyday habits: coffee instead of water, first thing in the morning, long stretches without drinking, heated indoor air, certain medications that dry you out, mouth breathing at night, and lower intake of water-rich foods. Suddenly, you have the perfect setup for thick mucus all day long. Now let me tell you the pairing I see most often: low-grade reflux plus low-grade dehydration. That combination is incredibly common. Reflux irritates the throat and stimulates mucus production. Dehydration makes that mucus thicker and slower to clear. So the body creates more, and the body clears less. That is the loop. And because both factors can be subtle, people do not notice either one clearly enough to name it. They just experience the final result, the constant coated throat feeling. This is why two people can have the same amount of reflux, but only one feels miserable. The difference is often in hydration, tissue dryness, mouth breathing, and mucus thickness. So if you remember only one combination from today, remember this: irritation plus thickness equals persistence. And now we come to the fifth cause, which is discussed less often but is becoming harder to ignore. Cause number 5, gut health, inflammation, and the gut-airway connection. For a long time, people thought of the throat, lungs, stomach, and gut as separate systems with separate problems. But the body is not divided the way textbooks are. Your digestive system, immune system, and airways constantly communicate. What happens in the gut can influence inflammation elsewhere in the body, including the upper airway. This is sometimes described as the gut-lung or gut-airway connection. Now, I want to be careful here. I am not saying every person with throat mucus has a gut problem. And I am not saying yogurt is going to cure a symptom that is actually being driven by reflux or sinus inflammation. What I am saying is this: when the gut microbiome is out of balance, when the diet is low in fiber, when antibiotics have disrupted normal bacteria, when stress is high, when sugar intake is excessive, or when digestion is chronically irritated, the body's inflammatory tone can change. And in some people, that seems to make the airways more reactive. That means more irritation, more sensitivity, more mucus, more inflammation that is felt in places far away from the original digestive imbalance. This is why some people notice that their throat symptoms are worse during periods when their digestion is off, when they are bloated, when they have been on repeated antibiotics, or when their diet has become heavily processed and low in plant foods. Again, this is not the first thing I would blame in every case. But it is one of the reasons some people keep chasing the symptom in the throat while missing the broader inflammatory pattern underneath it. And when you support the gut gently and consistently, with better fiber intake, less ultra-processed food, more fermented foods if tolerated, and a steadier eating pattern, some people notice that their baseline inflammation begins to calm down. Not overnight, but gradually. And gradual changes are often the ones that last. Now, before I give you the action plan, I need to pause for something very important. When this is not a just manage it yourself situation, most persistent throat mucus is not dangerous. In many cases, it is exactly the kind of pattern we have been talking about today: reflux, sinus drainage, dry tissue, medication effect, or low-grade inflammatory irritation. But there are times when throat symptoms should not be treated casually. Please seek proper medical evaluation if you have any of the following: mucus that is repeatedly tinged with blood, a lump in the neck or persistent swelling, difficulty swallowing that is getting worse, pain when swallowing, unexplained weight loss, a persistent voice change that is not improving, a choking sensation, shortness of breath, recurrent chest infections, or symptoms that are severe enough to disrupt eating, sleeping, or hydration. These signs deserve real medical attention. Do not try to out-home remedy them. Now let us move to the part that matters most, what you can actually do. The action plan, what to start tonight and tomorrow morning. I want to keep this practical because information without action only gives temporary relief. 1. Stop eating at least 3 hours before lying down. If silent reflux is part of your problem, this is one of the most useful starting points. Going to bed on a full or partly full stomach increases the chance that stomach contents will move upward during the night. Give your body time to digest while you are still upright. 2. Raise the head of your bed slightly, not by stacking soft pillows under your head, because that can bend the neck and sometimes make things worse. What helps more is a gentle incline through the upper body, for example, a wedge pillow or elevation under the mattress. Gravity is simple, but powerful. 3. Drink water strategically, not randomly do. Do not wait until you feel strongly thirsty. Start the morning with water before coffee. Sip through the day. Keep water visible. Use herbal tea, broths, and water-rich foods if plain water is hard for you. The goal is not perfection. The goal is consistency. 4. Pay attention to overnight dryness. If you wake with a dry mouth, bad breath, or a sticky throat, mouth breathing may be part of the issue, so may dry indoor air. If the air in your bedroom is extremely dry, especially in winter, that alone can make morning mucus noticeably worse. 5. Use saline nasal irrigation correctly. A proper saline rinse can help if post-nasal drip or chronic nasal inflammation is involved. Use safe water as directed for nasal irrigation products, follow the instructions carefully, and give it time. Daily use works better than occasional use. 6. Review your medications. Bring a written timeline to your next appointment. When did the symptom begin? What medications were added or changed in the months before it started? Do you take an ACE inhibitor? Do you take medicines that dry you out? Do you use pain relievers frequently? That kind of clear history helps clinicians much more than, "I have had this for a while." 7. Support the gut gently. This does not mean chasing expensive supplements. Start with basics. More fiber, more vegetables, fermented foods if you tolerate them, less late-night heavy eating, less excess sugar, and attention to digestive symptoms you may have ignored. 8. Stop clearing your throat aggressively all day. I know that sounds impossible, because the urge feels automatic, but repeated hard throat clearing can actually irritate the tissue more and keep the cycle going. When possible, try a sip of water, a swallow, or a gentle cough instead of a forceful throat scrape. That one habit alone can reduce irritation over time. A quick word on popular home remedies, because I know many of you have tried them. Honey, soothing for an irritated throat, and for many people it feels calming. But soothing is not the same as solving. Honey may help the sensation temporarily, but it does not tell you why the mucus is there. Apple cider vinegar. This is popular online, but if reflux is part of your problem, adding more acid may irritate the throat further. Be cautious. Cutting dairy. Dairy does not create mucus out of nowhere in every person, but some people do feel that dairy changes the texture of existing mucus or makes it feel heavier. If you strongly suspect a pattern, try a short structured trial rather than guessing day to day. Steam, often helpful for loosening thick mucus temporarily, especially when dryness is a major factor. Lozenges, good for temporary comfort, but again, they are symptom tools, not cause tools. And that is really the message of this entire video. You do not get lasting progress by fighting the symptom alone. You get progress by identifying the driver. Let us bring it all together. If you have been dealing with persistent throat mucus, especially after 55, here are the 5 causes we covered. silent reflux that irritates the throat without classic heartburn, post-nasal drip from chronic nasal or sinus inflammation, medication-related throat irritation, especially from ACE inhibitors, chronic mild dehydration that thickens mucus and slows clearance, and the broader gut-airway inflammatory connection that can raise the body's reactivity over time. Now, which two are most often working together? In my experience, the most common pairing is silent reflux plus mild dehydration. One creates irritation, the other creates thickness. One tells the body to produce more, the other makes it harder to move. And together they create that stubborn feeling so many people describe. It is always there. It is worse in the morning. I can never fully clear it. I keep drinking water, but it keeps coming back. I am always scraping my throat. If that sounds like you, I want you to take away one powerful idea today. You are not imagining this. You are not overreacting, and you do not have to settle for vague advice forever. Your body is giving you information. It may be saying, something is coming up from the stomach, something is draining down from the nose, something in the medication list needs reviewing, something in your hydration is off, or something in your broader inflammatory pattern deserves attention. But whatever the cause is, it is not random. And once you stop seeing the symptom as a nuisance and start seeing it as a clue, you can finally respond in a more intelligent way. Tonight, do 3 things. Finish dinner earlier, drink water before bed, and notice how your throat feels tomorrow morning before you do anything else. That one observation alone may teach you more than another month of guessing. If tomorrow morning is noticeably better after a simple evening change, that is useful information. If it is not better, that is useful too. Because the goal is not to panic. The goal is to become observant. The body often whispers before it shouts, and persistent throat mucus is one of those whispers that many people live with for years without ever decoding. I do not want that to be you. I want you to understand what is happening, test the most likely triggers, and take the symptom seriously enough to investigate it, but not fearfully. Calmly, systematically, practically. Because once you know what pattern you are dealing with, you can stop trying 10 random remedies and start doing the few things that actually match your body's needs. And that is where relief begins. If this conversation helped you, share it with someone who is always clearing their throat, always carrying water, or always saying, I do not know why this keeps happening. A lot of people are quietly living with this symptom and blaming themselves, their age, or the weather, when the real cause is much more specific than that. And before you go, pay attention to your own pattern again. Is yours worse in the morning? Worse after meals? Worse all day? Worse when the air is dry? Worse when your nose feels active? Worse after starting a medication? Because the answer to that question is often the first step toward getting your life back from a symptom you were told to ignore. Take care of yourself, listen closely to your body, and remember, symptoms are frustrating, yes, but they are also information. The more clearly you understand them, the more clearly you can respond.